Good evening, everybody. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans, right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hyperpigmentation, and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne. To many, acne is also known as blemishes, blackheads, whiteheads, pimples, or cysts. It is most common during puberty and adolescence. According to recent data, almost 80% of people in the age group of 11 to 30 years have acne outbreak at least once. Although acne most commonly does not have many serious health concerns but is de-stressing for the sufferer, the faster the issue is diagnosed, more effective will be its treatment. Thus, knowing about acne management from an expert is essential. For this, today we have with us Dr. Pallavi Kashyap, a consultant dermatologist and cosmetologist from Patna, live with us to educate us more on acne do's and don'ts. Dr. Pallavi is a consultant dermatologist at Skin Radiance Clinic, Patna. She is a gold medalist and distinction holder with an experience of over 7 years. Today, Dr. Pallavi will talk on do's and don'ts in acne management. A very warm welcome to you, Dr. Pallavi. It's a pleasure to have you with us.
Thank you. Thank you so much.
As today, Doctor, we are going to discuss about do's and don'ts in acne management. First of all, we would like to understand what is acne and what are the major causes of acne.
Acne is nothing but basically a simple bacterial infection which happens in our sebum, the sebum which is secreted from our sebaceous glands. And these sebaceous glands are present all over the body, including our scalp, not in our palms and soles. But people generally mistake that acne only happens over face, but that's not true. It happens over chest, back, it happens over anywhere where the sebaceous secretion is present. And the sebaceous secretion, there is infection from a bacteria called Propionibacterium acnes, and which causes further inflammation, and then acne occurs. And if the healing is not proper and the treatment is not proper, then it leads to scarring.
Okay. So that's basically acne. And when we talk about the causes, you said, due to oversecretion of oil it may cause. But what are the other factors? Again, during puberty, adolescence, we see a lot of teenagers or people going through acne breakouts. What are the causes responsible for that?
Definitely, the teenagers are the specific group of the population which suffers more from acne. It is generally because of the imbalance hormonal secretions and more amount of testosterone and estrogen imbalance. But it's not true that it only happens with the teenagers. It can happen in adults also. That's called adult onset acne. And acne can be associated with our various factors in our body. It can be associated with the polycystic ovarian disease. It can be associated with the insulin imbalance in our body. Sometimes only stress can cause acne. Sometimes the other infections which are already prone inside the body can cause superadded infection also, which can lead to acne. So there are so many other things which are basically correlated with acne. So you have to be very smart enough to visit your dermatologist as early as possible so that the basic cause behind the acne can be diagnosed and treated. So self-treatment is quite dangerous when it comes to acne.
Right. But I'm sure you'll also agree with me in this that most of the time or many times people start doing home remedies or visiting a chemist, going for some over-the-counter medication, tube ointment, something, and doctor comes at the last spot. I mean, only when they have worsened the problem, then only they land up in front of a doctor. Now what I like to understand is that how bad the home remedies or over-the-counter treatments can be for our skin or acne.
See, when it comes to home remedies, I'll list out few things which I generally see people doing it, like applying aloe vera gels and applying various other food ingredients on their face and fruit extracts, and then sometimes they are applying this multani mitti and other gulab gel. There's so many things which people are applying and thinking that acne will be subsided. But as I said, it is not something which is superficial, that is present only over the skin. It has an inside relation, in court relation with your inner imbalance as well. So if you're only treating something from outside and that you are not treating well, so it will not go off. So, and what happens that people tend to exfoliate the skin, that कि जितना रगड़ेंगे शायद हो सकता है skin साफ हो जाए और acne नहीं आए, but gradually the exactly opposite happens, that when you exfoliate your skin a lot, then basically you are triggering the sebum response, and you're triggering your skin and you're exposing your skin more towards the foreign body. So it is advisable that home remedies are fine to one extent, but you cannot treat something with home remedies. So it's better you come to a dermatologist and take the proper treatment so that your acne doesn't lead to, as you said, the PIH, like post-inflammatory hyperpigmentation, or any scarring, because that becomes more difficult to treat.
Right. And as we are continuously saying, the faster the issue is diagnosed, more effective will be its treatment. Thus, visiting a dermat, visiting a qualified dermat should be on the priority list as soon as we see any acne breakout or anything which is not usual for a skin. We need to go and consult a doctor. Again, as said that, most of the time people will go to the chemist and say, "Bhaiya, koi cream de do, pimple aa rahe hain." And they'll start using a cream without even letting the doctor know about it. How harmful could that be?
Yeah, it is something which is majority of the population is doing, especially the triple combinations and steroid combinations are being rampant use for acne as well. And it just lead to the, sometimes see, the steroid can act as an anti-inflammatory agent, so the inflammation part may subside and you feel that yeah, we are getting relief with this so-called medication, but
Right.
the infection part will not go off, and sometimes it just triggers the response so much that people get pustular acne also. So it is better that you should avoid taking any steroid combinations or any so-called on the over-the-counter medication, because that will definitely not help you to treat your acne until and unless if it's grade 2 or grade 3 acne, then you have to take oral medication as well, because it will not go like only with the topical medication.
राइट द आयरनी इज अगर आप किसी से पूछें कि डॉक्टर के पास क्यों नहीं जा रहे हैं, एक्ने की प्रॉब्लम है, तो वो कहते हैं अरे डॉक्टर स्टेरॉइड्स दे देते हैं। और अल्टीमेटली हम क्या करते हैं, हम भी तो ओवर द काउंटर जो ट्यूब्स लेते हैं, मैक्सिमम उनमें स्टेरॉइड्स होते हैं। तो बजाय इसके हमें डॉक्टर के पास जाना चाहिए, बिकॉज दे नो व्हाट दे आर गिविंग, व्हाई दे आर गिविंग दैट, व्हाट शुड बी द डोजेज एटसेट्रा, एंड दे नो आवर स्किन and the requirement of our skin. So please visit a dermat. Doctor, many times, heat की वजह से बहुत ज्यादा एक्ने ब्रेकआउट होता है। आजकल मास्क इतना इन हो गया है, हमारे लाइफ का इंटीग्रल पार्ट हो गया है। कई बार मास्क हटाते हैं तो इतना पसीना हो जाता है, और ऑयल एटसेट्रा, एंड वी सी अ लॉट ऑफ एक्ने in that particular part which is covered by mask. So can heat cause acne breakouts?
Yes, because when it's hot, we sweat, and sweating will definitely lead to accumulation of sweat in the open pores, where the seborrheic secretion, and this can lead to infection and cause acne. So yeah, heat is one of the factors which can lead to an acne breakout, but that is very temporary. It can go off easily with some topical medication, but never steroids, never.
Exactly. And again, does acne is specific to any season or occurs throughout a year? Because again, people during, especially, when the season is changing, there is change in weather, etc. People will complain that they are having acne breakouts. Is there any correlationship between weather change, seasons, and acne?
As we discussed that in summers we sweat a lot, and when we sweat a lot, then definitely the chances of infection are more, but there is nothing, any correlation between the seasonal variation, or whenever your skin and sebum is exposed to Propionibacterium acnes, or you are exfoliating your skin a lot, or the internal factors are there, then definitely you will have an outburst of acne.
Okay. We always say prevention is always better than cure. Any way that we can prevent acne?
Acne can be prevented by, see, there's so many diets. People say
Mhm.
that somewhere the food we eat is responsible. To some extent, it's true. High glycemic index food or anything which is very oily or spicy, and sometimes, especially the fast food, which has a lot of salt intake as well as sugar also. So that you have to avoid, and then you have to give a different change in your lifestyle also. A little bit of exercise, a little bit of stress-free meditation is required, and lots of water. This is just the basic thing which has to be done. And the most important is your scalp health. If your scalp is not healthy, your face will not be healthy at all. It will always have something or the other over the face. So your scalp should be equally healthy. Then only your face will be.
As you mentioned, your scalp should be equally healthy. My question is, many a time, dandruff again is very common in our society. People suffer from dandruff, and when we have dandruff, again, rather than visiting a trichologist or a dermatologist, we try to treat it with the, products available over the market, over the counter, etc. Um, what should be the right way? Because it's just not about our scalp or our hairs; it's also about our skin, and it can cause acne. So, what should we do?
If it's just a mild dandruff, you can always use an anti-dandruff shampoo, which is available with ketoconazole or cyclopalaxolamide. There's so many other antifungal agents here. Valiconazole is there. So you can use at least 2 to 3 days in a week and get rid of your dandruff. It's a simple seborrheic dermatitis. But if there are flakes and it's not getting subsided by even using the anti-dandruff shampoos, then you have to consult a dermatologist, because again there are different reasons behind the seborrheic dermatitis as well. So you have to be little um, quite aware that yeah, this can also lead to acne. So that's how
Um,
you, and especially people have this tendency of oiling their scalp a lot. So if oil drains over your face, it is actually damaging your scalp and face both. So I often tell my patients that please don't oil your scalp, and even if you want to, just oil half an hour before the shampoo. There shouldn't be any oil in the scalp or face at all.
right, because we have this tradition of oiling our scalp very often, keeping it overnight, and many people even, go to the extent of going out with that oil on the
Yes.
scalp. So you're saying that's not a good practice?
It attracts
Okay.
all the dust and all the infection possible, and you're basically carrying that the whole day and whole night, and it seeps on over your face. Then you can imagine definitely it will have the clogging of pores and leading to acne. So it should be avoided.
Okay, fair enough. And as you were discussing the, dietary things, what we can avoid, etc., is it true that milk and dairy products aggravate the acne breakouts, or is it just a myth?
It's somewhere true also. Few people, especially, have developed a lot of inflammation because of dairy products, we can say. So yeah, in some cases, people often tell me also that when I'm having a lot of dairy products, then a lot of inflammation happens, and that is leading to more outbursts of acne. So yeah, some people it can be true.
Mhm. And doctor, you also said that it's not just about teens or people in their early 20s or late teens that they will only have acne. Acne can also come with people who are adult in their 30s, etc. Now, what is adult onset acne?
As we discussed earlier also, that yes, definitely the acne is not a thing which only teenagers are having. So adult onset acne is basically acne in people who are more than 30 years of age, or sometimes more than 40 years of age also suffer
Mhm.
from acne. So that has to be completely correlated with the kind of hormonal imbalance they are facing in their body, or any kind of stress levels they are having in their particular lifestyle, or any lifestyle associated diseases they are carrying with themselves. That can be various array of other diseases associated with acne. So when anybody comes with an adult onset acne to you, have to be quite evident enough to rule out the reason behind it. Sometimes it is not just the propionobacterium acnes which is leading to acne. So it is another causes inside your own body which is having the acne flare up, because skin is the mirror of your body. Whatever
Right.
happens inside is basically reflected outside through your skin. So whenever skin is showing symptoms, you have to be very vigilant about it, and definitely think that whatever is happening inside, you have to be quite aware of that fact as well.
राइट और इसीलिए हम बार बार कह रहे हैं कि डॉक्टर को दिखाना है, क्वालिफाइड डर्मेटोलॉजिस्ट को दिखाना बहुत जरूरी है, क्योंकि आप जैसे होम रेमेडी या ओवर द काउंटर मेडिकेशन से ट्रीट करने की कोशिश कर रहे हैं, हो सकता है कोई अंडरलाइन मेडिकल कंडीशन हो, तो उसे आप लगातार इग्नोर करते जा रहे हैं. तो प्लीज गो एंड कंसल्ट अ क्वालिफाइड डर्मेटोलॉजिस्ट इन केस यू हैव एक्ने prone skin or you have acne breakouts. Now, doctor, what treatments do you recommend for acne?
Acne treatments are basically categorized according to the grade of acne. So we have grade 1 acne where there's only little inflammation present, or sometimes inflammation is absent also. Only the closed and open comedones are seen, and slight eruption of little bit of acne is there. So in that, even the topical application helps. Sometimes we give retinoic acid, sometimes we give benzyl peroxide, then gentamicin, adapalene. These days, minocycline is also there. 4% of minocycline ointment is also available. So many other topical agents are available. No steroids at all, because no, steroids are completely prohibited when it comes to acne. So that we can be used. Then definitely a good sunscreen is very important. I always prefer a physical sunscreen or a chemical sunscreen rather than, and that too in a very matte or gel form, which is better for any acnetic patients. Then they always have this confusion that these all ointments lead to little dryness of the skin. So the dryness has to be taken care with a moisturizer also. A nice gel-based moisturizer is also required. People often think that whenever there is acne, obviously there's a lot of oil secretion happening, that there is no need of moisturizer, but that's not true. If your skin will be dry, it will be exfoliated. And if you don't use a moisturizer, it will lead to more onset of acne. So a moisturizer is very important. Then a good cleanser is also important, but no scrubbing and no exfoliating when it comes to acne. This is grade 1. When it comes to grade 2 and grade 3 and the other cystic acne also sometimes, then we have to give oral medication also. Then oral medication lies between isotretinoin, then doxycycline, then azithromycin, and sometimes we have to see that whether there's a lot of inflammation present, then we have to mix two medication also. That certainly depends upon what the patient condition is, and we have to give systemic as well as topical medication, and the sunscreen and moisturizer and cleanser follows with that. So that's how we treat acne.
Okay, now talking about the cleanser, moisturizer, and sunscreen thing, I mean, you said that this is a very basic daily skincare regimen that we need to follow, even if we have oily or acne-prone skin. Now, the thing is, as you said, with moisturizer, people have this notion in their mind that we already have oily skin. Why do we need moisturizer? Now, you have already explained that. But again, with cleanser, what people who have oily skin assume is that they need to keep on washing their face quite frequently with a face wash or a cleanser, and that will keep their skin oil free and thus acne free. Is it true?
See, whenever it comes to a cleanser, the cleanser should not be harsh. It should not have a lot of chemicals. A simple salicylic acid or sometimes benzoyl peroxide also helps, or glycolic acid cleanser with less than 2% of those contents in that face wash is good. But more than 2 times, if you're completely recurrently cleaning your face, that might lead to damaging and exfoliating of your skin, and this will lead to further onset of acne. So this trend and this concept which you are actually, it's a very nice concept that you are highlighting, that people have this tendency of washing their face often, but that certainly doesn't help. So it's quite okay if you wash your face even twice or thrice in a day. That's more than okay. And just be a little vigilant with your moisturization and sunscreen part, because if you're not protecting your skin during the day and during the night, you can never expect that your skin can be healthy and acne free.
Fair enough. And now with the sunscreen thing again, people have n number of complaints with that, like it makes their skin very patchy, dull, or they sweat a lot after applying a sunscreen, and they often feel that, see, I'm already having acne. I mean, why should I add on, using a moisturizer and a layer of sunscreen over it? I should keep it, as breathy as possible, as clean as possible. I'm sure you must have, seen patients
Yes,
coming to you with the
yes.
same explanations or excuses for not using sunscreen. What's your take on that?
People often tend to think that a doctor is giving me a sunscreen because they think that somehow they'll be um, benefited out of it. But that's true, because if you don't give sunscreen to anybody, the solar radiation and the photo damage of the skin can lead to exfoliation and breakouts, which will further not let you get the acne treated. And the worst part is that it will cause a lot of inflammation, and the healing will cause hyperpigmentation, which nobody wants. Nobody wants that after the acne heals, it becomes black. So the sunscreen prevents from PIH, which is, and moisturization again is very important, because if you are not moisturizing your skin and it is constantly dry because of isotretinoin, which we give in acne, then the benzyl peroxide, or even sometimes the retinoic acid also, it further dries up the skin. So if you're not moisturizing it, then again the itching will happen, the PIH can happen. So you have to do both things religiously, irrespective whether you have acne or you don't have acne.
Right. So you need to follow this, simple skincare regime. It's just about a cleanser, moisturizer, and a sunscreen. We'll talk about it further, but then Pooja Pandit is here asking a similar question, which is related to pimples and scarring. मुझे कभी-कभी मुहासे हो जाते हैं और उससे मेरे चेहरे पर काले दाग हो जाते हैं. इसके लिए मुझे क्या करना चाहिए? कोई उपाय बताइए.
जैसे कि हमने अभी डिस्कस किया कि आपको फेस नहीं रगड़ना है, आपको एक प्रॉपर केमिकल और फिजिकल सनस्क्रीन मोर देन 30 SPF और 30 SPF यूज करना है. इट शुड बी मैट फिनिश एंड इट शुड बी जेल बेस्ड, और इट शुड बी नॉन कोमेडोजेनिक सनस्क्रीन एंड easily available है. You can always visit a dermatologist कि आपके स्किन को कौन सा सनस्क्रीन सूट करेगा. सो सनस्क्रीन लगाएंगे तो आपका स्किन जो है वो प्रोटेक्ट होगा तो धूप से डैमेज नहीं होगा, और डैमेज नहीं होगा तो पिगमेंटेशन नहीं होगा. एंड यू डोंट हैव टू स्क्रब योर स्किन एट ऑल. This people have a tendency of rubbing their skin a lot, which is quite bad. One shouldn't do it.
Exactly. Suman Yadav is curious to know, why does acne appear most often in teenagers?
As we discussed, the teenagers, there's a lot of hormonal imbalance going on in our body. The puberty is all about your hormones, whether it's male or female. So definitely the acne, the seborrheic secretion is quite related with the hormonal imbalance in the body. So if the hormonal regulation is not correct, or it is in a surge, then definitely the seborrheic secretion will increase. And when the seborrheic secretion will increase, the chances of infection are more. So that's why the puberty people tend to have more acne than rather than in the older age.
Right. Rekha is asking, should I stop wearing makeup if I have acne?
Makeup is completely fine, but you have to use a good sunscreen as a base first. You have to completely protect your skin, and please check whether the makeup you are using is good or not, is non-comedogenic or not, and whether it is having a lot of harmful chemicals or not, it is paraben free or not. Makeup is fine, we all do it. I mean, we are born for it. But then of course, you have to check which makeup you're using and whether you're using a correct cleansing routine or not. That is no exfoliation, a good cleanser, a good sunscreen, and a good moisturizer. This is very important.
Right. Raman Singh is asking, can what I eat cause acne breakouts?
Of course, we discussed that a lot of people have acne breakouts because of having a lot of dairy products. Some then food which have high glycemic index are completely prohibited. You shouldn't have. Of course, once in a while is fine, but that can definitely increase the onset of acne. And again, then spicy things, and sometimes all this like fast food and junk food and a lot of sugary substance. You should avoid salt and sugar in excess, and you have to have lots and lots of water. That is very
Okay.
important.
विजेता मोदी इज आस्किंग, मैम मेरी एज 16 है, 16 है, तो क्या मुझे डेली सनस्क्रीन लगानी चाहिए?
Yes, as मैं हमेशा पेशेंट्स को बोलती हूँ कि सनस्क्रीन इज जस्ट लाइक अ क्लॉथ. जैसे आप कपड़े पहनते हैं टू कवर योरसेल्फ, वैसे ही आपको सनस्क्रीन लगाना है टू कवर योर फेस एंड टू कवर द एक्सपोज्ड एरियाज. इट इज वेरी इंपॉर्टेंट.
Now, Dr. Pallavi, as you know, today we are discussing do's and don'ts in acne management. Bits and parts में हमने do's and don'ts discuss किए हैं. But फिर भी अगर मैं बहुत concrete पे मैं आपसे पूछूं, what are the do's and don'ts in acne management?
Do's से पहले बात करते हैं. Let's talk positive things first. So do's is that कि आप कोई भी सेल्फ ट्रीटमेंट नहीं करेंगे. आप कभी भी एक्ने हो तो उसको ऐसे पिंच करके बर्स्ट नहीं करेंगे. आपको एक्ने है तो आप ओवर द काउंटर जाके मेडिकेशन नहीं करेंगे, और आप कोई भी होम रेमेडी से स्किन को एक्सफोलिएट नहीं करेंगे. यू विल ऑलवेज विजिट अ डॉक्टर एंड चेक व्हाट इज द रीजन बिहाइंड योर एक्ने एंड फॉलो दैट. और आप अपना स्किन का एक्सफोलिएशन नहीं करेंगे, स्क्रबिंग नहीं करेंगे. आप एक अच्छी सनस्क्रीन यूज करेंगे, केमिकल फिजिकल 30 SPF sunscreen, gel based, matte, non-comedogenic, and then you'll be using a moisturizer in the night, which should be gel based, water based, and should have cetyl alcohol or ceramide containing moisturizer. Oatmeal containing moisturizer is very good that you can use, and multiple times आपको face cleansers नहीं use करना. So, and oiling of your scalp, especially, don't keep a lot of oil in your scalp. That is very important, because whatever is here on your scalp is completely reflected over your face. So these are the do's that you should completely do it. And some don'ts also I've discussed here. Don'ts are basically key, again, कि you don't have to be quite skeptical कि अभी acne है तो use कर लेते हैं, बाद में sunscreen नहीं use करना. It's not like that. You have to be very religious with it. Then you have to not have a lot of exfoliation, and then you have to keep a check on your lifestyle as well. Stress management, PCOS, then your diet also helps, and water intake also. All this matters. So if you are experiencing acne despite of doing whatever I have told you right now, then definitely you need a doctor, because sometimes systemic medication is important for acne. And please listen to your doctor. Don't fall in the trap of all these influencers so-called are there over the Instagram and different social media platforms. Please don't fall into the trap of that. I've seen so many patients who actually come to me and tell me the treatment कि मुझे ये करना है, ऐसे करना है, और आप ये करके दे दो. And it quite just surprises me that I had never that sorts when I was reading that I can go to a doctor and tell them ki do this for me. So I don't know, please don't fall into that trap. Always listen to your doctor, because the doctor will always tell you something which is beneficial for you for a long run. So please listen to your doctor. That is very important. These days, a lot of chemical treatments are available. The chemical peels are there, then the laser treatment is there. So people tend to use a lot of at-home chemical peels on their own, and they keep on damaging their skin. So chemical peeling is a completely OPD procedure which has to be done by a qualified dermatologist. So please come to your doctor and ask your doctor that which chemical peel is actually important for you. These days, so many other treatments are quite famous, like hydrofacial or PRP or microneedling, but everything has an indication. And please come to your doctor to basically understand that what is basically required for your skin type and for your etiology and for your face. So this has to be very much evident these days, and this is the most difficult part you face in your OPD practice, because people don't tend to listen what you want to say. They have their own preconceived notions and own preconceived thoughts, and they tend to budge that on you. But yeah, so these are basically my do's and don'ts. If you follow this simple thing, I think you'll get rid of acne very early.
राइट। होता यही है, हम आमतौर पे अगर दूसरा कोई ऑर्गन हमारा अफेक्टेड है, हमें पेन दे रहा है, चेस्ट पेन होता है, तो हम कभी ओवर द काउंटर जाके नहीं बोलते कि शायद मुझे हार्ट अटैक आ रहा है, कोई दवाई दे दो। वी गो टू द राइट पर्सन व्हिच इज अ कार्डियोलॉजिस्ट इन दैट केस। स्टमक में बहुत एक्सट्रीम पेन है, या हमें लगता है कि ऐसा ना हो स्टोन हो या कुछ और हो, तो हम डॉक्टर के पास जाते हैं। हम कभी उसको ओवर द काउंटर या सेल्फ मेडिकेशन से ट्रीट करने की कोशिश नहीं करते। Then skin is our biggest organ, longest organ of our body.
Yes.
We need to, and as we are continuously saying that what's happening inside, you can see it on through your skin, because skin is the mirror of our body.
Yeah.
Please don't neglect it. Please don't ignore it. If you have anything, go and consult a doctor, a right person, which is a qualified dermatologist in case of your skin or your scalp related issues. प्लीज बहुत देर मत कीजिए, क्योंकि होता यही है, हम वक्त जाया करते हैं, हमारी कंडीशन और खराब हो जाती है, और जब तक हम डॉक्टर के पास पहुंचते हैं, चीजें बहुत मुश्किल हो जाती है ठीक करने में। अगेन एज यू सेड कि बहुत सारे सलून बेस्ड ट्रीटमेंट्स हम लोग करते हैं या दूसरी चीजें होती है। कई बार फ्रेंड एंड फैमिली में अगर किसी को एक्ने है, वो डॉक्टर के पास गए, उनका जो प्रिस्क्रिप्शन है वो हम लेकर चले जाते हैं कि अच्छा ठीक है, डॉक्टर से तो दिखाया था ना, हमने डॉक्टर का ही प्रिस्क्रिप्शन फॉलो कर रहे हैं। वी डोंट अंडरस्टैंड कि और इसका क्या वो हो सकता है, इम्पैक्ट हो सकता है। वी जस्ट गो विद द प्रिस्क्रिप्शन, डू व्हाट आवर फ्रेंड और फैमिली हैज डन, or we go to a saloon or parlor, or wahan pe they have all kinds of needling of the acnes and various facials available for that. Again, acne kitna in sab se heal ho sakta hai?
See, chemical peelings are quite good. If you're coming to a qualified dermatologist, they will basically suggest you that what kind of chemical peeling is required in your case, and that helps beautifully. But again, it has to be done by somebody who is qualified, not somebody who doesn't know that which peel causes what. Then again, microneedling is not something which is for the infective part or the inflammatory acne. It has to be done for the scar or hyperpigmentation. So if you're having active acne, you cannot just go for microneedling and feel that it will be subsided. Sometimes the post-acne ice pick scars, there are scars present over the whole face because of the previous acne episode and it was not taken care properly. So that's why I'm telling you, whenever you have acne, please visit your doctor so that it doesn't heal in the way and it form a permanent scar over your face. That shouldn't happen. And sometimes people come with a permanent scar. Then you have to go for other treatments like laser treatments, fraction treatment, then PRP treatment, other various treatments are available. So when you have a lot of inflammation over your face and active acne, you cannot go for all these invasive procedures. It will worsen your acne a lot.
राइट। और होता भी यही है, कहा भी यही जाता है कि एक्ने को ट्रीट करना फिर भी आसान है, उसके स्कार्स को ट्रीट करना बहुत मुश्किल हो जाता है। इसलिए जरूरी है कि हम राइट टाइम पे डॉक्टर के पास पहुंचे। Many of us have this habit of continuously touching our face, popping out those or squeezing out those acne. इससे भी क्या स्कार्स होते हैं और वो स्कार्स फिर परमानेंट हो जाते हैं?
Of course, as I told you कि scarring क्यों होती है, जब हमारा healing properly नहीं होता है। अगर healing properly नहीं होगा तो collagen properly develop नहीं करेगा, collagen properly develop नहीं करेगा तो आपका पिट हो जाएगा, वहाँ स्कारिंग हो जाएगी, वहाँ गड्ढे दिखने लगेंगे और ऑब्वियसली आपका फेस आपको उतना प्रेजेंटेबल नहीं लगेगा। तो इसीलिए कभी भी उसको पॉपिंग नहीं करना है। कभी भी एक्ने है, जस्ट लीव इट लाइक दैट, डोंट एक्सफोलिएट इट एंड कीप रबिंग इट। और आप सिंपल एक क्लिंडामाइसिन ऑइंटमेंट यूज कर सकते हैं, अडाप्लिन यूज कर सकते हैं, बेंजोइल पेरोक्साइड यूज कर सकते हैं ऑन दिस स्पेसिफिक एरिया सो दैट only that area is affected and that can be treated like that. Don't keep on budging and nudging that acne because that will not help you at all.
I think there was some network glitch. Yeah, so doctor, I'll take one question which Urvashi Patel is asking. Okay, I'm from Patna. I have a question. That is, there any special concerns for women of childbearing age about acne?
Of course, that is adult onset acne. I don't know her age. What is her age right now? So if you're facing acne after a childbirth, definitely there is a lot of hormonal imbalance going on inside your body. Then sometimes postpartum stress is also there, which leads to acne outburst. And obviously, when you have a baby and post pregnancy, you don't have that kind of time to take care and have a good skin regimen. So you definitely should visit your doctor and ask them for a good regimen for you and what is the reason behind your acne outburst.
Right. And doctor, as you emphasize the need or necessity of using a sunscreen regularly, ये भी कहा जाता है कि बहुत जरूरी है ये देखना कि आपका सनस्क्रीन क्योंकि बहुत सारे इंफॉर्मेशन बॉक्स पे होते हैं जब हम सनस्क्रीन लेने जाते हैं, SPF, PA+++, नॉन कॉमेडोजेनिक एक्सेट्रा एक्सेट्रा, प्लस उसका रीएप्लीकेशन कितना अमाउंट ऑफ अप्लाई कर रहे हैं, ये सब भी दे प्ले इम्पोर्टेंट रोल। इसके बारे में भी हम चाहेंगे आप ब्रीफ में थोड़ा हमें बताएं।
See, whenever you are using sunscreen, you have to use your sunscreen half an hour before the sun exposure. That has to be done. But these days, so many different sunscreen will have come that you can actually use it 5 minutes prior also. But I often tell my patient that before sun exposure, at least half an hour before you apply your sunscreen, and reapply the sunscreen after every 3 to 4 hours. So I often mention the time also, like 8 a.m., 12 p.m., 2 p.m., like that. So even if the patient applies it twice also, that will help.
पर हमें उस हैबिट में आना होगा, बिकॉज द ट्रुथ इज कि अभी भी 67% ऑफ इंडियन पीपल आर नॉट यूजिंग सनस्क्रीन एज अ डेली केयर रेजिमे। उनको लगता है बहुत धूप में जा रहे हैं, बीच वेकेशन पे जा रहे हैं तो यूज करना है, हम तो घर पे वर्क फ्रॉम होम कर रहे हैं, हमें क्या जरूरत है। तो आई थिंक वो प्रैक्टिस थोड़ा वो माइंडसेट बदलने की जरूरत है। I'll quickly take another question. Doctor, are you there? I think there is again some network issue. Okay, so we are talking about acne management do's and don'ts, and I have a question from Amisha Sen asking, क्या acne blood impurities की वजह से होता है? Dr. Pallavi Kashyap, are you there with us? I think there is some network issue. सो बेसिकली जितनी हमने बात की उसमें से सबसे इम्पोर्टेंट बात यही है कि अगर एक्ने हो रहा है या कोई इश्यू आपके स्किन में है तो यू नीड टू विजिट अ क्वालिफाइड डॉक्टर, अ क्वालिफाइड डर्मेटोलॉजिस्ट, और सेल्फ मेडिकेशन, ओवर द काउंटर मेडिकेशन, फ्रेंड एंड फैमिली के प्रिस्क्रिप्शंस फॉलो करना, होम रेमेडीज, ये सब अवॉइड करना चाहिए। सो विद दैट आई थिंक we are at the conclusion part of this session. So आज हमने बात की Dr. Pallavi Kashyap से, and we are really thankful that Dr. Pallavi gave us her valuable time, and एक बहुत informative session भी ये रहा, and आप भी as viewers हमारे साथ जुड़े, तो please stay connected with us, stay beautiful, stay spotless. Thank you so very much for joining us. Thank you. Goodbye.
Hi, I'm so sorry, the sudden glitch in my.
I thought so. I almost, winded up the whole session assuming that you are not here, but at least I'll try take one of this question that Amisha Sen is asking, and it's quite common with people, is that क्या acne blood impurities की वजह से भी होते हैं?
There is a very common notion that people generally take blood purifiers when they have acne because that's what that is advertised in the television also. And there's a very famous blood purifier which people are often using. I can't name that, but it is a completely wrong tendency. It has nothing to do with your blood impurities. It is a super added infection, superficial infection. It has to be done. It has a lot of impact from your systemic imbalance as well, but that has nothing to do with your blood impurities. No.
Okay, it was wonderful talking with you, Dr. Pallavi Kashyap, and it was a very informative session. Thank you so very much for
Thank you.
giving
I'm
your
so
valuable
sorry for
time.
the glitch. My system just, completely stopped. I don't
We
know
can
how.
understand. We can understand. So thank you so much once again, and we are really looking forward for many more such sessions for our viewers in the coming times. Thank you
Thank
so
you
very
so
much.
much. It was amazing. Thank you.
Thank you. And viewers, thank you for your participation in today's session. Stay beautiful, stay potless, stay connected with us. Thank you. Goodbye.
Bye.
Ma'am, we can close the meeting. We
Yeah,
can.
yeah, yeah. Okay.
Thank you.
Okay.